Welcome back to the deep dive, where we take those complex topics and try to make them a little bit easier to understand.
Yeah.
So today we're going to be doing a deep dive into EKGs.
Okay.
You shared with me a really fascinating guide that's written for nursing students all about EKGs. And I have to say, I learned a lot reading through this.
That's good.
And so I'm really excited to have you here to help me break this down and understand, what are we looking at when we see these squiggly lines and what do they tell us about the heart's rhythm?
Yeah, EKGs can be a little intimidating when you first glance at them, all those lines and squiggles. But once you kind of understand the language, it opens up a whole new world into like the heart's electrical activity.
Yeah, it's a whole secret code that we're going to try to break today.
Absolutely.
So we are going to be exploring all sorts of different rhythms, from the perfectly normal heartbeat to those rhythms that can signal trouble. So let's just start with the foundation, the normal sinus rhythm, or NSR. So this is the rhythm that we hope to see on those EKG monitors.
Right.
What makes this rhythm so normal?
So in normal sinus rhythm, the heart is basically functioning exactly how it should. So the SA node, which is in the right atrium, is acting as our pacemaker. It's sending out those electrical signals that travel through the heart in a very organized way. Those signals spread through the atria down to the AV node and then to the ventricles, causing them to contract and pump blood.
So the SA node is like the conductor of the orchestra,
Exactly.
and the rest of the heart is following along.
Keeping everything nice and synchronized.
I like that analogy.
Yeah. So when we look at a normal sinus rhythm, EKG, we should see those P waves, which represent the atria depolarizing, then the QRS complex, which is the ventricles depolarizing, and then the T waves, which is the ventricles repolarizing.
Okay, so what happens when the rhythm gets offbeat?
Yeah.
That's where arrhythmias come in, right?
Right. So when the heart's electrical activity gets disrupted, it can lead to arrhythmias, which are basically abnormalities in the heart's rhythm. And our guide breaks them down into two main types: supraventricular and ventricular arrhythmias.
Okay, can you explain the difference between those two?
Sure. So supraventricular arrhythmias originate above the ventricles.
Mm-hmm.
So in the atria or the AV node, which is that relay station between the atria and ventricles. Ventricular arrhythmias, on the other hand, start in the ventricles themselves.
Okay, so location is key when it comes to understanding these arrhythmias.
Exactly.
So let's start with those atrial rhythms, like that feeling of your heart skipping a beat.
Uh-huh.
Is that arrhythmia?
It can be.
Yeah.
That's often what we call a premature atrial contraction, or PATE.
Yeah.
It's basically an extra beat that originates in the atria, and it can feel like a flutter or skipped beat.
Okay, and our guide mentions that PACE can be triggered by things like stimulants like coffee or even depressants like alcohol.
Right. Anything that kind of affects the autonomic nervous system can sometimes trigger PACE.
So that skipped beat after my second cup of coffee might actually be a PIC.
It very well could be.
But thankfully, the guide also says that they're usually harmless.
Yeah, for most people, PACs are nothing to worry about. They're very common, especially people who are otherwise healthy.
Okay, so let's move on to atrial flutter, which I understand can be a little bit more serious.
Yeah, so atrial flutter is when the atria beat very rapidly in a regular pattern. It's like a short circuit in the electrical wiring of the heart.
Okay.
So instead of contracting normally, the atria just kind of quivers very rapidly, sometimes up to 300 beats per minute.
Wow, that's 3 times faster than a normal heartbeat.
It is, and that's why it can be problematic, because the atria aren't effectively pumping blood into the ventricles.
Okay.
Now, on an EKG, atrial flutter creates this very distinctive sawtooth pattern, which makes it pretty easy to recognize.
Okay, I'm picturing those little triangles.
Exactly.
Okay, so then there's atrial fibrillation, or AFib, which I feel like is the one that we hear about the most often.
Right. AFib is probably the most common serious arrhythmia. It affects millions of people.
Wow.
And it's similar to atrial flutter in that the atria are quivering instead of contracting effectively. But in AFib, the rhythm is completely irregular. It's like an electrical storm in the atria.
So it's not that nice, neat sawtooth pattern.
You know, in an AFib, the EKG looks very chaotic with no discernible P waves and an irregular ventricular rhythm.
Okay, and what makes AFib so dangerous?
Well, because the atria aren't pumping effectively, blood can pool in them, and that increases the risk of blood clots forming.
Oh,
And those clots can then travel to the brain, causing a stroke.
so that's why we hear so much about AFib and stroke risk.
Exactly.
Okay. Now, so far we've talked about rhythms that originate in the atria. What happens when the AV node, our backup conductor, has to take over?
Yeah.
Our guide refers to that as a junctional rhythm.
Right, so the AV node normally acts as that relay station between the atria and the ventricles, But if the SA node fails or the signal from the SA node is blocked, the AV node can step in and become the pacemaker.
Okay.
And that's what we call a junctional rhythm.
Okay.
Now, the heart rate in a junctional rhythm is typically slower than in a normal sinus rhythm, usually between 40 and 60 beats per minute.
Okay. And are junctional rhythms usually dangerous?
No, most of the time they're not. They're often well tolerated, especially if the heart rate is adequate.
Okay.
But if the heart rate gets too slow, it can cause symptoms like fatigue, dizziness, or lightheadedness.
Then that's when treatment might be necessary.
Exactly.
Okay, so we've talked about rhythms that originate in the atria or the AV node. What about those that start in the ventricles themselves?
Yeah.
Those seem like they could be much more serious.
They can be because the ventricles are responsible for pumping blood out to the body. So when their rhythm is disrupted, it can seriously compromise the heart's ability to do its job.
That makes sense.
Yeah. So ventricular arrhythmias are generally considered more serious than supraventricular arrhythmias.
Okay, let's unpack these ventricular rhythms one by one. So first up, we have premature ventricular complexes, or PVCs. These are kind of like the ventricular version of PACs, right?
Right. PVCs are extra heartbeats that originate in the ventricles instead of the atria, and they can feel like a skipped beat or a fluttering sensation in the chest.
Okay, and what causes PVCs?
Well, they can be caused by a variety of factors, including heart disease, caffeine, stress, electrolyte imbalances, and even certain medications.
So even though they feel like those skip beats we talked about earlier, their origin really matters in how we interpret them.
It does, yeah. The location of the arrhythmia is a key piece of information when we're trying to determine its cause and potential seriousness.
Okay, so those are PVCs. Next, we have ventricular tachycardia, or VT. That sounds pretty intense.
It can be. VT is a rapid heartbeat that originates in the ventricles, and we're talking rates of over 100 beats per minute.
Wow.
Yeah, so it's much faster than a normal heart rate.
And what happens when the heart is beating that fast?
Well, it can be a real problem because the heart doesn't have enough time to fill with blood between beats.
Uh-huh.
So it can't pump blood effectively to the body.
Duh.
Now, VT can be sustained, meaning it lasts for more than 30 seconds,
Right.
or non-sustained, which means it comes and goes.
And which one's more serious?
Sustained VT is definitely more serious because it can lead to a drop in blood pressure and even cardiac arrest.
Okay, so sustained VT is the one that sends everyone into emergency mode.
Yep.
But then there's ventricular fibrillation, or VFib, and our nursing guide paints a pretty grim picture of that one.
Yeah, VFib is the most serious of the ventricular arrhythmias. It's basically a chaotic electrical storm in the ventricles.
Oh, no.
The ventricles just quiver instead of contracting, and no blood is being pumped out to the body.
So it's basically the heart stopping.
It's a medical emergency that requires immediate treatment with defibrillation and CPR.
That sounds terrifying.
It's a life-threatening situation.
Okay, so we've got PVCs, VT, and VFib. What does treatment look like for these ventricular rhythms? Is it different depending on the type?
It definitely is. The treatment for ventricular arrhythmias depends on the type of arrhythmia, severity of the symptoms, and the overall health of the patient.
Okay.
For example, for infrequent PVCs that aren't causing any symptoms, treatment might not even be necessary. But for sustained VT or VFib, we're talking about serious interventions like defibrillation and medications to try to stabilize the heart rhythm.
So it sounds like a whole range of different approaches.
It is, yeah, it really depends on the individual situation.
This is all so fascinating, but I can see how it could easily get overwhelming for someone who's just starting to learn about EKGs. It's a whole new language.
It is, but like with any new language,
Yeah.
once you learn the basics, it becomes much easier to understand.
Well, that's encouraging. And speaking of deciphering, we still have a lot more to explore. Our guide also covers heart blocks, those disruptions in the electrical signals traveling from the atria to the ventricles.
Right.
It's like traffic signals on those electrical pathways.
Exactly. And when those signals get disrupted, it can lead to a variety of problems.
Okay, so let's dive into the world of heart blocks next. Okay, so let's dive into the world of heart blocks next.
Yeah, heart blocks are basically disruptions in the electrical signals that travel from the atria to the ventricles, and they can range from mild to severe depending on how much of the signal is blocked.
Our guide mentions 4 types of heart blocks: first degree, 2 types of second degree, and third degree, also known as complete heart block. Can you walk us through these different types?
Yeah, so let's start with first degree AV block. This is the mildest form of heart block. The signal from the atria to the ventricles is delayed, but it always gets through eventually.
Okay, so it's like a slight hesitation at a traffic light.
Yeah, exactly. It's slow, but it's still green.
Okay, so a minor delay, but not a complete blockage.
Right on an EKG, you'll see a prolonged PR interval, which is that flat line between the P wave and the QRS complex.
So in first degree heart block, that PR interval is stretched out a bit.
Yeah, it's longer than normal, but the key is that all of the P waves are still followed by a QRS complex.
Okay. And our guide says that first degree heart block is often harmless.
Yeah, it is. In most cases, first-degree heart block doesn't cause any symptoms and doesn't require treatment.
Okay, but then we get to second degree AV block and things start to get a little bit more complicated.
Yeah, with second-degree AV block, some of the signals from the atria are completely blocked, so not all of the P waves are followed by a QRS complex.
Okay, so it's like some of those cars are getting stuck at the red light.
Yeah, that's a good analogy.
Now, our guide mentions two types of second degree block, type I and type 2.
Right, type I is also called Wenckebach, and it's characterized by a progressive lengthening of the PR interval until a P wave is not conducted and a QRS complex is dropped.
So it's like a traffic light that's getting slower and slower until it finally turns red and skips a cycle.
Exactly. And then with type 2, the PR interval is usually constant, but some of the P waves are randomly blocked without any warning.
Oh, so it's like a random roadblock suddenly appearing on the electoral highway.
Yeah, that's a good way to think about it.
Okay, and which type of second degree block is more serious?
Type 2 is generally considered more serious because it can progress to complete heart block.
And complete heart block is where things get really serious, right?
Yeah, in third degree or complete heart block, the signal from the atria to the ventricles is completely blocked. There's no communication between the top and bottom chambers of the heart.
So the atria and the ventricles are basically beating independently.
Exactly. They're like two separate orchestras playing different tunes.
And that can't be good.
No, it's not. The ventricles will usually try to beat on their own, but they do so at a very slow rate, usually around 30 to 40 beats per minute, and that's not enough to sustain life.
So that's where pacemakers come in, right?
Exactly. A pacemaker is a small device that's implanted under the skin, and it sends electrical impulses to the heart to keep it beating at a regular rate.
So for people with complete heart block, a pacemaker can be a lifesaver.
Absolutely. It's a very effective treatment for this condition.
Okay, so we've talked about heart blocks and how they disrupt the electrical signals traveling from the atria to the ventricles. But our guide also mentions something called the electrical axis of the heart. What is that exactly?
So the electrical axis is basically the overall direction of the heart's electrical activity. It's like a compass pointing toward the strongest electrical signal.
Okay, so it's not a physical axis, but an electrical one.
Right. It's determined by the way the electrical impulse is spread through the heart muscle.
And why do we care about the electrical axis?
Well, a shift in the electrical axis can sometimes indicate problems with the heart, like changes in heart size or position, or problems with the conduction system.
So it's another piece of the puzzle that helps us assess the heart's overall health.
Exactly.
Our guide mentions a few specific conditions that can cause axis deviations, like left ventricular hypertrophy and right bundle branch block. Those sound pretty technical. Can you break them down for us?
Yeah, so left ventricular hypertrophy, or LVH, basically means that the left ventricle has become enlarged.
Okay.
This can happen for a number of reasons like high blood pressure or aortic stenosis. And this extra muscle mass in the left ventricle can cause the electrical axis to shift to the left.
Okay, so LVH can cause a left axis deviation. What about right bundle branch block?
So remember we talked about bundle branches earlier. They're part of the heart's electrical wiring system, and they help to conduct the electrical impulses to the ventricles.
Wrong.
Well, in a right bundle branch block, or RBBB, there's a blockage in the right bundle branch, which delays the electrical signal to the right ventricle.
So the signal is detoured.
Exactly. And this delay causes a characteristic pattern on the EKG, which often results in a right axis deviation.
Fascinating. So these axis deviations can provide valuable clues about underlying heart conditions.
They can. It's just another piece of information that we use to put the whole puzzle together.
Well, speaking of putting the puzzle together, our nursing guide also talks about the importance of recognizing bundle branch blocks because they can mask other EKG abnormalities.
Yeah, that's true. Bundle branch blocks can make EKG interpretation a bit more challenging because they can distort the normal EKG patterns.
So it's like trying to read a map with part of it obscured.
Exactly.
Okay, so let's talk about bundle branch blocks a little bit more. We already touched upon RBBB when discussing those axis deviations, but there's also left bundle branch block, or LBBB. What are some of the key features we should be looking for?
So with LBBB, the electrical impulse is blocked in the left bundle branch, which delays the activation of the left ventricle. This delay results in a widened QRS complex on the EKG, and often a left axis deviation.
Okay, and I'm guessing RBBB also causes a widened QRS complex, but with a right axis deviation.
You got it. The QRS complex is our clue that something is up with the bundle branches. but it's important to differentiate between left and right bundle branch blocks because they can have different clinical implications.
This is making me realize just how complex EKG interpretation can be.
It's not always easy, but it's a crucial skill for anyone working in healthcare.
Well, our guide also delves into the world of antiarrhythmic medications, those drugs that are used to treat abnormal heart rhythms.
Yeah, those are an important part of managing arrhythmias.
So it's like fine-tuning the heart's electrical system with medication.
You could say that antiarrhythmic medications work in a variety of ways to either suppress abnormal rhythms or slow down a heart that's racing out of control.
Our guide mentions a few specific classes of antiarrhythmic drugs: beta blockers, calcium channel blockers, and a class called cardiac glycosides. Can you break down these pharmacological families for us?
Sure, so beta blockers work by blocking the effects of adrenaline on the heart. They help to slow down the heart rate and reduce blood pressure.
Okay, so they help to calm the heart down when it's in overdrive.
Exactly.
What about calcium channel blockers?
Calcium channel blockers work by blocking the entry of calcium into the heart muscle cells, which also helps to slow down the heart rate and reduce blood pressure.
So both beta blockers and calcium channel blockers aim to slow down the heart rate, but they work by targeting different mechanisms.
Yeah, that's right. They have different mechanisms of action, but they can both be effective in treating certain types of arrhythmias.
Okay, and then we have cardiac glycosides. Our guide specifically mentions digoxin as an example. What are cardiac glycosides and how do they work?
Cardiac glycosides are a group of drugs that increase the force of the heart's contractions. Digoxin is the most commonly used cardiac glycoside, and it's been used for centuries to treat heart failure and certain types of arrhythmias.
Centuries. Wow, that's a long time. What makes digoxin so special?
Well, digoxin works by inhibiting the sodium-potassium pump in heart muscle cells. This leads to an increase in intracellular calcium, which in turn strengthens the heart's contractions.
Oh, so it's like a strength training regimen for the heart.
Exactly.
But our guide mentions that digoxin can be a tricky drug to manage.
Yeah, it does have a narrow therapeutic window, which means that the difference between an effective dose and a toxic dose is quite small. So it needs to be used carefully, and patients need to be monitored closely for side effects.
Okay, that makes sense. Now, our guide also emphasizes the crucial role that nurses play in caring for patients with arrhythmias. After all, they're often the ones on the front lines monitoring those heart rhythms and providing essential care.
Absolutely. Nurses play a vital role in the care of these patients.
Our guide highlights a few key areas of nursing care for these patients: continuous EKG monitoring, medication administration, and patient education. Let's delve into each of these, starting with EKG monitoring. What makes continuous EKG monitoring so crucial for patients with arrhythmias?
Continuous EKG monitoring allows us to see the heart's electrical activity in real time so we can detect any abnormalities right away.
So it's not just about checking the heart rate, but actually analyzing the entire EKG waveform.
Exactly. Nurses are trained to recognize different arrhythmias based on the shape and pattern of the EKG waveform. They can identify things like premature beats, tachycardia, bradycardia, and even those life-threatening rhythms we discussed earlier,
Yeah.
ventricular tachycardia and ventricular fibrillation.
Early detection of those abnormalities can be life-saving, can it?
It can, absolutely. By recognizing arrhythmias early on, nurses can alert the medical team and initiate appropriate interventions, which can potentially prevent serious complications.
Okay, so EKG monitoring is crucial. What about medication administration? What are some of the key considerations there?
Well, medication administration for arrhythmias requires a high level of precision and attention to detail. Nurses need to be familiar with the different classes of antiarrhythmic medications,
Yeah.
their mechanisms of action, their potential side effects, and how they interact with other drugs.
It sounds like a complex pharmacological dance.
It can be, but nurses are highly skilled in this area. They carefully calculate dosages, monitor patients for adverse reactions, and adjust medications as needed based on the patient's response and the physician's orders.
Okay, and then finally we have patient education. Why is that so important in the context of arrhythmias?
Patient education is crucial because it empowers patients to take an active role in managing their own health. Nurses teach patients about their specific arrhythmia, the purpose and potential side effects of their medications, and lifestyle modifications that can help control their symptoms.
So it's about giving patients the tools and information they need to become partners in their own care.
Exactly. It's a collaborative approach, healthcare professionals and patients working together to achieve the best possible outcome.
This has been an incredibly enlightening deep dive into the world of EKGs and heart rhythms. We've covered so much ground already, from the basics of normal sinus rhythm to the complexities of arrhythmias, heart blocks, and pacemakers. We've also explored the role of medications and the critical role nurses play in caring for patients with these conditions. But before we wrap up this episode, I want to touch on one more important aspect of EKG interpretation. So, our nursing student guide emphasizes that EKG interpretation isn't just about identifying individual rhythms, but it's also about recognizing patterns and putting all the pieces together to get that complete picture of what's happening with the heart.
It really is like detective work.
Yeah.
You're looking for clues in that UKG, tracing those subtle changes in waveform shape, timing, and patterns, and all of that helps you kind of solve the mystery of what's going on with the heart's electrical system.
So, what are some of those key clues that we should be looking for?
One of the most important things is to assess the overall morphology of the EKG waveform. The shape and size of those P waves, QRS complexes, and T waves.
Can you give us some examples of how changes in morphology might provide those clues?
Sure. So, for instance, a tall peaked T wave can be a sign of hyperkalemia. That's a high potassium level in the blood, which can be really dangerous.
Wow. So even something as seemingly simple as the shape of a T wave can be really significant.
It can, and then there are ST segment changes, elevations, or depressions in that portion of the EKG waveform, which can indicate myocardial ischemia or injury.
And myocardial ischemia, that's a lack of blood flow to the heart muscle, right?
Yes, and it's often a sign of coronary artery disease.
So recognizing these ST segment changes can be crucial in diagnosing and treating heart attacks.
Absolutely, time is muscle when it comes to heart attacks. So the sooner we can identify those telltale EKG changes, the sooner we can intervene and potentially limit the damage to the heart muscle.
It's amazing how much information can be packed into those squiggly lines. Now, our guide also mentions the importance of calculating heart rate from an EKG. Is there a specific method for doing that?
There are actually several methods, but one of the simplest is the 6-second method. You simply count the number of QRS complexes in a 6-second strip of the EKG and multiply that number by 10.
So if you count 7 QRS complexes in 6 seconds, the heart rate would be 70 beats per minute.
Exactly. It's a quick and easy way to get an estimate of the heart rate. Of course, for a more precise measurement, you would use an automated EKG machine.
Okay, good to know. Well, as we wrap up this deep dive into EKGs, I want to touch on a point you made earlier about EKG interpretation being like detective work. It's not just about memorizing a bunch of rules and patterns. It's about understanding the bigger picture, the interplay of anatomy, physiology, and clinical context.
Absolutely. EKG interpretation is a skill that takes time and practice to develop. It's about connecting the dots, seeing how different pieces of information fit together, and always remembering that the EKG is just one piece of the puzzle when it comes to assessing a patient's overall health.
That's such a great reminder. We've covered a lot of ground in this deep dive, but I hope it sparked a curiosity in our listeners to learn more about this fascinating field.
It really is a fascinating field, and there's always more to learn.
Well, to our listeners, if you're intrigued by the world of EKGs, we encourage you to keep exploring, keep asking questions, and keep learning. And who knows, maybe someday you'll be the one deciphering those EKGs and helping to diagnose and treat patients.
That'd be great.
And on that note, we'll wrap up this episode of The Deep Dive. Thanks for joining us on this journey of discovery, and we'll catch you next time for another deep dive into a new topic.